I do have a comment. Both the two, Rossella and Mario, did perform, I would say, brilliantly, trying to correlate the mind and the body, and this is very important. At the same time, do you believe that, according to your list of bullet points relating to the importance of correlating ED and to use ED as a sentinel marker for, do you have data to justify that modifiable risk factors could really change life expectancy and the overall health condition of men? I do remember the data coming from, for instance, the endocrinological school from Naples, Catherine Esposito, roughly 10 years ago.
Andrea, these are data that are based on risk factors that we already know.
Exactly.
This is obesity, lack of physical exercise, but the message that I would like to give you today is new, because I think that we have to increase love, to increase life expectancy in male, and increase the bonding within the couple to increase life expectancy in males. Otherwise, males doesn't care, doesn't take in some way in consideration their general health.
So probably women, they live more because they need more love instead of drugs, and vice versa for men. I think it's a great and brilliant congratulations to your group, because you did a great job.
Yeah, it is a great message to me, take-home message, which is very important. Johannes.
I'm sorry, I want to play a little bit advocatus diaboli.
Of course.
We have heard that men lie a lot. So are you sure that among those who say they don't have extramarital affairs, that they don't have extramarital affairs?
I mean, this is obviously a problem, because you are right, but this is person that admit to do it. And just admit, so the point is, they lie a lot. So maybe there is more people that is doing and is not reporting. So, Johannes, we cannot...
Professor Jamie.
Yes, thank you for this presentation, but we speak a lot about medicalization, but we didn't speak of moralization. And it seems that there is a moral, cultural scenario, script beyond your presentation when you say that extramarital affairs are a risk factor. I'm wondering if it is not a moral proposal instead of a medical proposal that you are suggesting us.
I'm a scientist. I don't care about ethics. I mean, I'm just observing statistically significant events, and we only found that people that was doing extramarital affair, they have more often heart attack. And it was highly statistically significant. I mean, I don't want to say you have not to do it or you do it, but I'm saying you are at risk. More often you are at risk because you are more stressed, for instance, or because, but try to correct for all this confounding factor is still statistically significant.
Pedro.
I also, thank you for this. I think it's very provocative because it puts in a way that, I was just wondering, so as far as I understood, if you have extramarital affairs, your risk of developing coronary disease and so far is higher. But at the same point, as I understood, if your partner does not love you or is not
Correct.
willing to have sex with you, so he has hypoactive sexual desires, if I understood, the risk is not there. So it's also, so there could be several mediators there. I'm just wondering, love on one end, so if I don't feel wanted and if I look for sex with other partners, that will be not as risky, which is interesting. But on the other end, is that also because possibilities? Because if you have a stable partner, and as you said, women usually take more care of their health and so forth, and so they look so for their partners to do the same. So is that also, may also be linked with that? So a female partner will prevent them because will, be asking him to go more to the medical doctor and so forth and so forth. So What is your? Have you tried to disentangle all these potential mediated factors? So
we did some speculation that correspond to the speculation that you mentioned, and you understood right. I mean, if you betray a woman that does not desire you, the risk is similar to the rest of the sample. If you betray women that still is in love with you, you are at higher risk. The interpretation are several. You figure out some of these, but I don't have the resolution because it's difficult to say which is the mechanism, but it's very interesting.
Any further question? Okay, thank you, Mario. Thank you very much.